Imagine it's your job to take a photo of someone, the most important photo this person will ever have taken in their life. Now imagine that that photo turns out bad. You probably feel guilty and very disappointed. That's the reality for many doctors when they take photos of blood cancer tumours. I'm sure many of you have heard of cancer patients getting special scans done to look for the tumours in their bodies. These scans are done by injecting the patient with a special dye that's designed to stick to tumours so that we can take photos of them. These photos are incredibly important in cancer care. It can help doctors make a diagnosis, see if cancer is spreading, and see if treatment is working. But what happens if these photos turn out bad? What happens if this special dye isn't sticking to the tumour, and therefore we don't see it in the photo? That's what's happening in patients with chronic lymphocytic leukemia, the most common adult blood cancer in Australia. When patients with this blood cancer have their photos taken with this dye, the photos turn out blank, and we don't see tumours where we would expect, in their neck, chest, or bones. So what's going on? We know these people are sick, but why can't we see their tumours? It's because the dye that's used is made of a sugary material, which most cancers love and need to be able to grow. However, this type of blood cancer doesn't like sugar at all and actually prefers fat as an energy source. So when we take patients with this fat-loving blood cancer and take photos of them with the sugary dye, we get bad photos and we can't see their tumours. So how do we fix this? How do we give doctors better photos of these patients' tumours? The answer is we need a better dye. We need a fat-based dye that will stick to these fat-loving tumours so that we can take better photos of them. During the first year of my PhD, I was working on a new fat-based dye that I'd just started testing. To test the dye, I had been growing blood cancer cells in the lab, adding the dye to them and measuring how much gets stuck to the outside of the cell. And so far, results look promising. Once I have shown that this fat-based dye can stick to blood cancer tumours, I'll need to test this in a larger model. This will involve taking mice that have been given blood cancer, injecting them with the dye, and taking photos of their tumours. I'll also inject a few mice with the sugar dye and take photos of them, so I can directly compare the two to answer the question, can a fat-based dye give us better photos of blood cancer tumours? These photos are incredibly important in cancer care. Without these photos, it can be hard to make a diagnosis, hard to see if treatment is working, and hard to know if cancer is spreading. For many people, these are the most important photos they'll ever have taken in their life, so it's important we make them look better. Thank you.